Can start now.
Okay, guys. Good evening, everyone. I'm sorry for we had a technical issue with the Microsoft Teams. So Felix is actually working on it. So that's the reason why we thought that we'll do the class in Zoom. Probably tomorrow morning class in Malayalam will be also in Zoom meeting because I think it may take some time to figure out what's going on. Okay, so I think this will work for you guys today. And also, Felix will make sure that these classes are recorded and given to you. And Glaucia, I'm sorry, this was the reason why I couldn't send you the recordings of yesterday's class. Please allow us at least one day to figure out what is going on with the Microsoft Teams. Okay, I'm sorry about that. Okay, so in the first class we discussed about what is NCSBN and what is the computer adaptive test CAT and how the scoring works, how the graph works, and all such kind of things. And we also discussed a few questions to show you what my class is focusing on and things like that. Okay, so today we are going to start with two important things. One is how to read the question and how to summarize the question, and the next is to how to eliminate the option and how to reach the answers. Okay, so that is what we are going to learn today. So our first strategy, our main thing, as I always say, our focus is more on the question. Okay, so reading the question, cooking the question, bringing out the essence from the question, understanding the question properly, bringing out the keywords, understanding the keywords in the question. So, question, like, implement most of your effort on question. Okay, so put most of your effort on the question. Let's do a sample question here. If somebody's mic is on, can you please keep your mics muted? Manjinda? Thanks, Manjinda. Okay, so let's do this question. Let me ask sorry. Let me ask there are two iPhones here. Julie? Julie?
Hello. Yes.
Yes, Julie, can you read this question?
The nurse provides prenatal care at a busy obstetric office. Which pregnant client should the nurse prioritize to be seen first by the healthcare provider?
Okay, so Julie, before moving into the options,
Oh,
the first thing what you do is find out the keyword in the question and summarize the question. And everyone, what you do is please make sure that whenever you read the question word by word, please translate into your own language in your mind. Okay, anyhow, this class is there are people who speak different languages, so not here in class, but when you practice, please translate into your own language so it gives more clarity. So anyhow, who was answering actually now? Who was answering now?
yeah, I am.
Okay, Julie, sorry. Uh, so Julie, so what you do is right now bring out the keywords in the question and tell me what is the summary of the question. Tom, can you keep your mic muted?
Okay, sure.
Yeah. Yes,
Yeah,
Julie.
it's a prenatal care. Uh, uh, like care clinic nurses. Which the for the pregnant client.
Mhm.
Uh, which patient nurse will see first?
Yeah. So
Who is in it's to be which patient to be seen first?
yes, so very good. So you have four. In another way, this is how I summarize the question. So we have four pregnant ladies.
Okay.
And which lady will I visit first? or which lady will I care first, or who is my priority among these four ladies which is given. So that is a summary of the question. Okay,
Okay.
so it's just a prioritization question. You are identifying among this given four women, who will I um, take care of first. Okay, so that is a summary of the question. Now, before going to the options, please don't read option one, two, three, four. Okay, so what you do is do not look into option two, three, and four. Just read option one, and you have to do three things with each options. One is, if you know this is a correct option, you keep it. If you know this is wrong, you eliminate this option. If you don't know, or if you're not sure, you keep it, but also give a small explanation about that option from what you know. Okay, so that is why, you remember in the first class I told you they will give you a sheet in the exam. Okay, they'll give you a paper in the exam. You can scribble on the paper. Okay, so you just write a note, like if you don't know, or if you are just concerned about this, leave that option and write a note about that option. Okay, and go to the next option. Okay, so likewise you finish all the four option and compare with all the remaining options, like after you eliminate it. So you might be able to eliminate one or two or three options, and you might have one or two remaining. So with the remaining options, just go back to the question and ask yourself, which one should I take care of first. Okay, so Julie, go with the first option.
Pregnant client who is 9 weeks gestation, who is experiencing fatigue and reports severe nausea and vomiting.
Okay, so now, Julie, before going to the next option, we need to find out something from this option. Anyhow, prioritization questions we cannot eliminate, right?
Yeah.
Because which means that all the four are important. You will choose the most important among the given four. Okay, you are not able, you cannot eliminate anything in a prioritization question. So what you do is ask yourself, a pregnant client who is 9-week gestation. 9 weeks means it's maybe 2 months, right?
Mhm.
Who is experiencing fatigue and reports severe nausea and vomiting. Ask yourself, is this normal in 9 weeks? Is this okay to have a fatigue and nausea and vomiting in 9 weeks? Don't use your obstetric and gynecology specialization knowledge or anything. Just try to be a superficial entry level nurse when you're answering a question. Just think about what do you think, is this okay to have a or expected in 9 weeks?
Yes.
Okay, so this looks like it is expected in 9 weeks. Now go to the next question.
A pregnant client who is 14 weeks gestation who reports urinary frequency and lower pelvic pain.
Okay, now 14 weeks means it's now 3.5 month, right?
Yes.
So now ask yourself, patient is reporting urinary frequency and lower pelvic pain. Okay, so highlight it, lower pelvic pain and urinary frequency. Okay, what comes into your mind when you see this option? Is it okay to have a urinary frequency and lower pelvic pain in 3.5 month? What do you think? If you don't know, like, just be honest with your ideas. Don't feel bad about, oh my god, I don't know this. Okay, don't feel anything, just simply think about it. It's just an entry level knowledge. Okay, so what comes into my mind is, when it is 3 month, 3.5 month, the uterus might be becoming a little bigger, and it might be putting some pressure on the bladder, that could be the reason why there is a urinary frequency. Okay, so these are the things which comes into my mind. So what I do is I write those things on the paper about options too. Okay, so maybe uterus becoming bigger, uh, uh, putting pressure on the bladder. Okay, but I don't know. Like, I don't know.
Mm,
Okay, so I give a question mark also here
mm.
because later on we'll compare with all the four options to see which one is the most important. Go to the next one.
Pregnant client who is 24 weeks gestation who reports an increased fetal kick count.
Mm. So, fetal kick count. Do you know when does the fetal kick count start? I mean, fetal kicking, all those things starts. What do you guys think? Any idea? Like, even if you don't know, it's fine. But still, what do you think? Like
60.
22 weeks gestation, fetus is kicking. I'm not going to teach about obstetric and gynecology right now, but with whatever we know, with an entry level knowledge, we should answer any questions you get in the exam. So that's what I say. It's not about too much knowledge. It's about how you think and answer. Okay, now just generally superficially think. 22-week gestation. How many week gestation a baby will deliver?
39 weeks, 40 weeks.
39 weeks.
Okay, so 37 to 40,
39, yeah.
40 weeks. Okay, so now it's 22 weeks early. It's like it's a mid gestation period, right? So now, is there any problem in this? If fetus is kicking, is that a problem? Fetal
No.
kick is
No.
not a problem,
No, it's
right?
normal.
It's not a problem. Okay, so don't think too much. Okay, so just think fetus is safe, mother is safe, right? Fetus is alive, baby is alive, mother is alive. Okay, so it's not a problem. So not a big deal. Not a big deal. Write it down. Then go to the next one.
Pregnant client who is 34 weeks gestation who reports nausea and constant epigastric pain.
Hmm. So now, 34-week gestation. There is one more month uh, to for delivery, like expected date of delivery.
Mm,
Now 34 weeks. Patient is complaining of nausea and constant epigastric pain. Okay, now you look at that word constant, right?
mm,
A constant epigastric pain. This word is a little bit concerning, right? As I already told you, if you feel like something happening to a patient and you don't know what is going on with the patient, okay, if it is not expected, okay, then always that is your priority. So now, first one you can eliminate because the first option is expected. Nausea, vomiting is not a priority. Always in your exam, priority is something which can cause complication to the patient, something which can kill your patient. Okay, something which is harmful to the patient. Okay, expected things are not a priority in your NCLEX or XPN. Second one is when the bladder, when the uterus become big, it puts pressure on the bladder, so that's not a big deal. Third one, fetus is healthy, it is kicking. Okay, just simple knowledge, simple common sense to answer. It is not a big deal. Fourth one, we don't know what is going on with the epigastric pain. Why epigastric pain? But we don't know. But a constant epigastric pain is something bad and which need further investigation, right? So which need further investigation. So our priority is option 4. Okay, so this word constant is which help me to determine that option 4 is the correct answer. Okay, once again, I'm not right now, my intention is not to teach you what are the complication in gestation. Okay, my intention is just to show you, even if you don't know something, okay, there are some key words in the question and in the options which can help you navigate the question and reach your correct answer. Okay, so this word constant is something which is concerning. And as we move forward, you will get this kind of thinking ability, because all the questions what we practice will help you gain that skill. Whenever you read something, okay, you will know this constant. But previously, before attending the classes, probably you'll not be noting such kind of important keywords which will help you to eliminate, keep, or choose the options. Okay, so let's do another question. Any questions before we go to the next one? Any questions? Okay, so let's go to the next question and see how this one works. Mm, Emmanuel? Okay, Emmanuel, you there?
I'm there.
Okay, go ahead.
So, a client arrives at the emergency room reporting lightheadedness, nausea, and a headache that started after consuming cured meat and some leftover food for dinner, along with an artisan wine from a nearby vineyard. The tried nurse notes that the client has been taking phenelzine, brand name Nadil. Which of the following assessments should be prioritized?
Okay, Emmanuel, just one question. Have you done this question before? Like, have you seen this question before?
Um, yes, but not exactly this one.
Not exactly this one. I want somebody who have not done this question to answer, not a similar kind of question. So let me ask someone. Okay, Emmanuel, I'll give you another question.
Okay.
Um, Let me ask, is there anybody who haven't done this question before? Anybody? Okay, Jenny, go ahead. Try this one.
Okay. Here we have two possibilities. Like for my, I don't know actually. So I'm just trying. So first of all, we might think it's a food poison,
Mm-hmm. Very good. Yeah.
or or there is a drug. I don't know what action. What is the action of the drug? Nothing. I don't know. But is that a drug? I don't know. Maybe that is like I don't know what it is. I'm suspecting that is maybe because of Nardil
Mm.
also may cause the same side effects they have.
Okay.
So there's two possibilities we can see in this.
Mm.
And our assessment would be based on either food or this drug.
Awesome. Very good. So either it could be maybe. So let me just break this question. A client arrives at the emergency room reporting lightheadedness. Okay, let's. That is why I say always it's very important to hi highlight the keywords in the question. Okay, so reporting lightheadedness, nausea, and a headache. Okay, that started after consuming a cured meat. Okay, and some leftover food for dinner. Okay, along with an artisan wine. Now, basically, most of my students are from different countries, not from an English speaking country. So, probably most of you would have not heard about the word cured meat. We know what is leftover food. Probably you would have not heard about what is artisan wine, right? So, from a nearby vineyard. And now what happens is when you start reading, oh my God, this fellow, I paid him $650, and you know what, this fellow did not teach me about artisan wine. Okay, you start cursing me in the exam hall. I mean, because that's that's what happening sometimes. Then go to the next part. The triage nurse notes that the client has been taking phenelzine. Oh my God, again, this fellow did not teach me what is phenelzin is. Okay, too concerned and start cursing me again. Okay, my God, Nadal, I haven't heard about this. Again, this fellow, curse me, curse me, curse me. Okay, so which of the following assessments should be prioritized? Okay, so from this question, what I can understand, but this fellow has taught you something in the class. Lightheadedness, nausea, and headache is a classical sign of what? Of course, I haven't taught you, we haven't started the classes, but as you start my class, I will focus on one important thing. Headache is a classical sign of hypertensive crisis. Okay, nausea, lightheadedness, or what is that? Fainting, okay, whatever it is. Okay, so headache is a classical sign. That is what in the previous class, I don't know if I have mentioned about something, what is it? Some classical sign I told you. Okay, for example, a elderly woman in the long-term care having a UTI, the classical sign is disorientation, confusion. Okay, same thing like for high blood pressure, the classical sign is headache. So in our classes, we focus more on this one particular thing. What are the classical signs of each and every conditions? Okay, so that when NCLEX ask you headache, nausea, something, immediately what comes into your mind is hypertensive crisis. Okay, so now, uh, so we know that headache, nausea, and lightheadedness is hypertensive crisis. In case, even if you didn't think about it, okay, now you know that it could be either because of the food or because of the um, what? Because of the medicine. Okay, but you don't know whether this medication causes any of these things. Okay, so you go with option one, respiratory rate and oxygen saturation. You don't know. Okay, and just simply ask connected to the keyword. Does respiratory rate or oxygen saturation, high oxygen, low oxygen, does that cause a headache? No,
Yes.
right? No, no. Oxygen saturation, low oxygen will cause what? It causes restlessness. Okay, that is also a classical sign. Restlessness is a classical sign of hypoxia. I'll teach you all those things in the classes. Okay. Blood pressure and pulse rate, does that cause headache? Hypertension causes
Yes.
headache, right?
Yes.
So we
Yes.
know, we connect it. Potassium level, hyperkalemia, hypokalemia, does that cause any headache? Increased urine output, decreased urine output, does that cause any headache? No.
No.
Cardiac enzymes, ECG, does that cause headache? No. Okay,
No.
so here we know that, but blood pressure causes headache. Okay, so in this question, what NCLEX is expecting is not for you to know the action of phenelzin. Okay, not NCLEX is not expecting you to know that you should know the complication of phenelzin or side effect of phenelzin. What NCLEX is expecting you to know that you know that a headache is a classical sign of hypertensive crisis, right? So that is the entry level nursing knowledge. But what happens when we start preparing? Most of us, we focus on unnecessary things. So this is, of course, phenelzin, when it mixed with some aged food, it will cause hypertensive crisis. That is the knowledge. Okay, this particular medication, when it mixes with the aged food, like artisan wine means which is made at home, okay, or in the farmhouse. Okay, you heard of like artisan bread? Okay, they make at a farmhouse. Okay, so artisan is something they make in a farmhouse. So maybe this aged, or which has some kind of bacteria or maybe some kind of fungus in it, we don't know. Or cheese, artisan cheese is there, okay, which is made in a farmhouse. Those kind of food, when it mixes with phenelzin, it causes hypertensive crisis. But that is not an entry level knowledge. Okay, so that is beyond the entry level knowledge. So the entry level knowledge here is lightheadedness, headache, nausea is a classical sign of hypertensive crisis, and try to connect the option with the keyword in the question. Okay, so that is how we do it. So remember, first summarize the first find out the keyword in the question.
7 o'clock.
First, find out the keyword in the question. Second, summarize the question. Third, go with option 1, make a decision. Next, go with option 2, make a decision. Option 3, make a decision. Option 4, make a decision. And then whatever options are left, connect it with the keyword in the question, and that is your answer. Okay, so but the problem is that we need to change that attitude of our thinking. Like we start thinking about phenelsin medication, that pharmacokinetics, drug dose, side effect of medications. Okay, so that is when we end up answering the questions wrong. Okay, so people come and ask me like, how do you guarantee that if I join your class you will pass? I'll say I don't guarantee, because I don't want to guarantee, because I'm 100% sure about what I'm teaching. I'm 100% confident about what I'm teaching. But it is up to you guys how you change your attitude on your on handling the question and answering. Okay, so that is what we need. Any questions before we go to the next one? Okay. Okay, let's do the next question. Manjinder.
Yeah. Which of the following instructions is the most critical when educating parents about the proper administration and precautions for a child being discharged on and with suspension? What's that? I don't know. So,
In NCLEX, there is nothing called I don't know. Okay, and there's nothing about I don't know in NCLEX.
yeah.
And you have to bring out everything what you know in the question. Okay, whatever you know from the question, bring it out. So first, mark the keywords in the question.
Yeah, it's a most critical education, most critical that when educating parents, we have to educating parents about the proper administration
Mhm.
and precautions
Mhm.
for a child at the discharge time
About what?
on PNVK suspension.
VK.
Suspension.
Okay. Now, I have highlighted the keywords.
Yeah.
It's about education on administration and precaution of a child who is getting discharged on PNVK suspension. In other words, the summary of the question is, uh, which among the following 4 option is correct about this medication, PNVK suspension, right?
Yeah.
That is a summary of the question. Which
Yeah.
among the following 4 option is correct about this medication, PNVK suspension? And also add one more sentence to it. Say that I don't know what this medication is. Okay, because be honest with this thing. I don't know what PNVK suspension is. You can add this one too. I paid $650 to this fellow, and he didn't teach me PNVK suspension. Okay, I mean, no problem. You can add that also. Okay, anyhow. Now go with option 1.
Verify the expiration date of the medication.
Manjita,
Yeah.
I don't have any intention to teach you about PE and VK suspension. That's why I have never taught, even I haven't heard about PE and VK suspension. Okay, so go ahead.
Yeah. Yeah. Verify the expiration date of the medication before administering to ensure the potency.
Okay,
Um,
no, don't go to the next option. Do something with that option.
yeah, and just yeah.
What do you think about this one?
Um, it could be, but
Hmm.
I don't think so. This would be because the expiration they will give the medication while checking the expiry date.
Yeah, Manjit, the one thing probably would have learned in your nursing school is expiry date is very critical, the most important nursing responsibility before administering. Or in other words, the safety in medication administration is checking the expiry date. But now let's highlight this word expiry date of this medication before administering. It is important. Okay, so it is important like any medication. It's not just PE and VK suspension. Any medication expiry date is important, right?
Yeah.
Any medication you administer expiry, it's not just for PE and VK suspension. Go to the next one.
Shake the suspension well before each dose to ensure the medication is evenly distributed.
So now highlight that option, highlight the keyword here. Shake the suspension well before each dose to ensure the medication is evenly distributed. Is there any connection with the keyword here? What do you think?
Mm, just the suspension thing.
Yeah, so it
Shake
is
the
suspension.
suspension.
So it is talking about shaking the suspension. Go to the next
Suspension.
one.
Advice against taking the medication with grapefruit juice as it may interact with the drug absorption.
Okay, so now it is time for you to curse me because I didn't teach you about PE and VK suspension. So give a question mark. Go to the next one.
It's a recommended
Because we don't know whether this medication interacts with grapefruit juice.
juice
We
or
don't
not.
know, and this fellow did not teach us. So give a question mark. Go to the next one.
Recommended administering the medication before bedtime to enhance its effectiveness and reduce gastrointestinal discomfort.
Okay, again, you can say this fellow did not teach us whether the PNVK medication can be administered before bedtime. Okay, so this fellow did not teach us. So now, don't sit and cry in the exam hall. Try to connect with the keyword. Which one is your answer? What is your answer now?
It could be second B.
B is the answer because the question is not about PNVK. The question is about suspension.
Administration and
This is
precaution.
what happened. I always tell to my student, please don't talk to your friends or families who already went and wrote the exam. They will come and tell you, oh, they asked about one medication. The name of the medication is PNVK, and now you start reading the book about PNVK, and this is what happening. Okay, so that is what please don't talk to any of your friends, discuss about anything about NCLEX. They will fill you with fear. Okay, so be mindful of that. The question is not about PNVK. The question is about suspension. Anyhow, PNVK means it's penicillin, vitamin K. Sorry, penicillin and potassium. Penicillin V potassium medication. Something. It's an antibiotic. Okay, so anyhow, that's not important for us. That's not the entry level knowledge. So this is how your NCLEX works. Got it?
Yeah, thank you, sir.
Okay, now Emmanuel.
The nurse observes a parent swaddling their infant with an unrepaired. Sorry, I couldn't. Your face was blocking that part. The nurse observes a parent swaddling their infant with an unrepaired unfallowed cell. Which of the following statements will be appropriate? Let me repeat the question. The nurse observes a parent swaddling their infant with an unrepaired unfallowed cell. Which of the following statements will be appropriate? So here, the first thing to ask myself is the critical nature of the parents swaddling their infant with the unrepaired unfallowed cell. So how does that How is that critical to the child?
Okay. Now, Emmanuel, let me not help you. You just go ahead and do the question and answer it. And at the end, I'll tell you. Go ahead.
Okay. The first one, stop. You will kill your baby. I'll put a question mark on this one. Second one, that is a nice tight swaddle. It will really help suit your new baby. I will say no to this one. I will eliminate this one. Then the third one, may I help you? We will need to be careful with their intestines. We do not want the swaddle to push them back inside. I will put this one on the side because from the question, it seems that the parent might need a little bit help.
Very good.
Then the fourth one, swaddling is not allowed for these babies. Please stop. I would say the nature of this last one, the nature that is telling the parent doesn't really seem appropriate to compare with the third option.
Awesome.
So, and the first option is more direct. It is not really teaching the parent on how to do it correctly.
Very good.
So I would say option C is the correct answer.
Very good. Option C is the correct answer. Okay, now let me explain you something about this question. There's a few more points to add to it. The correct answer is option C. Remember, especially I have some students who don't know who didn't know what swaddling is. Okay, who haven't even heard about omphalocele. Okay, you may know, you may not know. It's not a problem. So now, from the question, we can understand the mother is doing something bad to the child, and the to the infant. Infant had a condition, maybe a infant condition, something unrepaired. We don't know. Let's say we don't know. Like, I'm just talking like a fool. Okay, I mean, I cannot use that word fool. I don't like to use that word fool. But like, say, don't know anything about nursing. Okay, but at least reading this question, mother is doing something bad, baby is having a problem, and now the nurse need to correct it. That is the question. That is the idea from the question. Okay, now you go to the option one, stop, you kill your baby. As Emmanuel said, it is not a therapeutic communication, right? It's not a appropriate way to talk to a patient, so you can eliminate it. That is a nice tight swaddle. It really helps soothe your new baby. Remember, in your NCLEX, every time a question has a problem, and that option needs an appropriate nursing solution for that. Okay, if your option is not a solution, that is not the correct answer. Okay, also keep that thing in the side of your brain when you answer a question. If you choose an option which does not give a quality nursing response, a quality nursing intervention, okay, or not a quality nursing solution, then that is not your right answer. Okay, so every time NCLEX is testing on you whether you are a good nurse giving a solution. Always your question has a problem and they are expecting a solution from the nurse. Option B is saying that the question itself is not a problem, right? So this is what something I said I wanted to add to it. Always remember, put it on your book, and whenever you are answering a question, use this strategy also. when you are answering the question. Every question has a problem, and CSBN is expecting a solution from me. Okay, that is not a school going child solution, an appropriate nursing solution from me. Okay, so in that way you can eliminate this option. And then rest of the thing Emmanuel already said. May I help you? Will you need to be careful with the intestine? By reading this itself, you understood that omphalocele is something about intestine. Okay, and swaddling is something like putting pressure on the baby's intestine, right? So there is a problem here, and now you are telling the mother in a very therapeutic way, please don't do it. Okay, so it looks like a good option, and option D is not therapeutic. So what I'm trying to say is, even if you don't know something, you can answer 99% of questions in your exam. Okay, so please don't sit in the exam hall and curse me. This fellow did not teach me that, did not teach you. Okay, please don't do that in your exam. I'm giving you all the skills necessary, because it's impossible for me to teach each and every nursing concept. It takes at least 2 years for me to complete everything, and all these things. My purpose is, my intention is not to make you Florence Nightingale, as I always say, not to make you big wonderful award nurses, just to help you pass exam. Okay, so that is what I'm trying to do. Okay, that is why I specifically focus on NCLEX, not too much on nursing theories. Okay. If you don't agree with me, please let me know, because I had, like, in the past, I had some students who didn't agree with these kind of things. They want knowledge, they want pathophysiology, they want big list of signs and symptoms. They wanted me to give a PDF of all the normal values for them to stick it in their study table. Okay, so those kind of things, this is not the right place for that, and I cannot do that. Okay, that is not the way I prepare for, and I prepared for my NCLEX, and that's not the way I teach. Okay, so remember, summarize the question, find out the keywords in the question, go with option one. I know this is good, so I keep it. I know this is bad, so I eliminate it. I'm not sure, so I keep it. Do with each and every option, and at the end you can eliminate one or two options, maybe even three options. Now if you have two or three options remaining, now with that remaining option, connect it to the summary of the question, connect it to the keywords in the question, and see which one is better connecting to the options. Okay, don't think like a gynecologist, don't think like a cardiologist. Okay, don't think like a respiratory specialist or anything. Think like a entry level nurse when you're answering the question. Okay. Okay, now this is a very difficult question to answer. Let's see if anybody can do it. Let me ask Jency.
A client with a history of heart failure visited the clinic. He stated, I have not been feeling like to my old self for about 2 weeks. I would be most important of the nurse to ask which of the following question. Option. Do your ankles swell? Hello?
Yeah, go ahead.
Okay.
Try it, and after you finish, I'll explain you.
Do your ankles swell at the end of the day? Second one is, where do you sleep at night? Third one, how do you feel after you eat dinner? Fourth one is, do you have chest pain when you inhale?
Client history of the heart failure visit in the
Okay, so what is your answer? Is that the way I taught you, Gen Z, to answer a question? Like you are just simply reading the options. Okay. You know what? In my language, there is a saying. If you put if you put a pipe into the tail of a dog for years, and then you remove it, goes back to its original position. Okay, so I don't know how it's very funny in my language. I don't know if other people from other other countries or in your language, if you have a similar saying. If you put the pipe and try to fix the tail of the dog to make it straight and keep it for years, and you remove it, it will go back to its original position. I don't want anybody of you to do that. I want you guys to change your attitude towards it. Okay, I want you guys to do exactly what I am saying. Okay, so these again, if you are looking to learn some knowledge from this, write notes, screenshot, and memorize things, you won't pass exam. Okay, I want you guys to literally understand, how to read a question, improve your skill in answering, not about learning concept, not about memorizing concept. Jinsi, try, I'm not even expecting a correct answer from you. Okay, I don't even expect a correct answer from you. What I'm expecting is to see how you navigate it, how you are reading it, how you are picking up the keywords. Even if it is wrong, it's not a problem. Okay, so Jinsi, first go ahead and mark the keywords in the question. Mark the keywords in the question and summarize the question. Go ahead.
History of head failure.
Okay, so history of heart failure. Then
Would be the most important place to ask.
okay, before that, there is something. Patient is saying, I have not been feeling like my old self for about 2 weeks. Right? What does that mean? What does that mean? I'm not feeling like my old self for 2 weeks, which means that patient had a history of heart failure, now feeling sick, right? Now feeling sick for 2 weeks. Okay, so that is what uh, the question is about. Having a history of heart failure, now feeling sick for 2 weeks. The question is saying.
Okay.
Now, what is the question? It would be most important for the nurse to ask which of the following. So, what are you going to ask? So, a heart failure patient is getting sick, which means that a heart failure patient getting exacerbation of heart failure. Okay, exacerbation of heart failure. All right. Now, what is a classical sign of heart failure? Anybody? What is it? Is somewhere I mentioned? I think I mentioned about this classical. I don't remember. If not, it's fine. Do you
I
guys?
believe it's soiling.
Hmm?
I believe it's soiling, ankle soiling, like a soiling
Swelling.
sign.
Swelling. Okay, swelling. Okay. Is there any other
Shortness
idea?
of breath.
Hmm?
Shortness of breath.
Shortness of breath. Okay, so it's not swelling. Swelling is the secondary sign of heart failure. The primary sign of heart failure is respiratory distress. Okay, breathing difficulty, shortness of breath, things like that. Okay, so I'll teach you about the pathophysiology. So let me ask you one thing. Is chest pain a sign of heart failure? Is chest pain a sign of heart failure? What do you guys think?
Yes.
No. Manjinder, no. Chest pain is not a sign of heart failure. Let me ask you something. Uh, is epigastric problem or indigestion a sign of heart failure?
No.
No. Okay. But I don't know, like in my country, some people believe that indigestion is something connected with the heart failure. Even my wife was telling me yesterday, I have some kind of indigestion. I'm worried if I'm having a heart failure. So I no, no, uh, no way. We had some spicy biryani last night, and that was the reason for her this thing. But epigastric pain is something connected with MI, okay, not with heart failure. Okay, so we'll talk about all those things. Anyhow, one important thing, if you attend my class, the future classes, you will learn that heart failure is always connected with breathing difficulty, and secondary is edema related signs and symptoms. So the primary is breathing. Okay, so let me write it down. So primary is breathing, and the secondary is edema related symptoms. Okay, so now the question the nurse is asking the patient should be about is something which investigate whether the patient having an exacerbation of heart failure. Okay, now go ahead with option one, Jensi.
Sir, is first one. Do you angle still at the end of the day?
Okay, now ask yourself, do your ankles swell at the end of the day? Is that a sign of exacerbation of heart failure? Is that a sign of exacerbation of heart failure? Okay, actually, ankle swelling is a sign, but is it just the end of the day? A question mark is there, or if it's just generally throughout the day? We don't know. Let's say if you don't know, but again, let's assign it to edema problem. Okay, it could be, we can connect that to heart failure. Go to the next one.
Better do you sleep at night?
Is there anything to do with uh, heart failure? Does that have anything to do with breathing problem, or is there anything to do with edema problem? Where do you sleep at night? Are you sure? No? Okay. People who work in long-term care as PSWs or caregivers, have you seen in your long-term care some people sitting on the recliner chair and sleeping? Have you seen people
Yes.
leaning forward on the
Yes.
overbed table and sleeping? Okay. Do you know what is the reason for that? It's because of breathing difficulty. Probably they might be having some COPD condition or something like that. So where do you sleep at night is actually connected to breathing. Okay, it's actually a very difficult question. Only people, think think so deep can answer this question. Okay, now go to the next one, third one.
How did you feel after you eat dinner?
Is there anything with fullness of stomach, eating dinner, connecting with heart failure?
Mhm.
No. Okay, because but in my country, especially in my state, in South India, Kerala, many people think that fullness of stomach is something related to heart failure, but it's not. I don't know about other countries, other cultures. Okay, then go to the next one.
Do you have chest pain when you inhale?
So, does the chest pain connected with heart failure? No.
No.
So your answer is option two. Where do you sleep at night? Okay, why I discuss this question is to let you know one more thing. If you list down some signs and symptoms for heart failure, list down some signs and symptoms of MI, you won't be able to answer this question. Okay, so it's not about simply taking notes. Even many people ask me like, "Give me notes. Why don't you give notes?" Other places they give notes. Okay, it's because I don't trust in any notes. That's why I don't give you any notes. Okay, I don't believe in any notes. Okay, so listen to the classes, gain that skill. Okay, that is what going to help you in your exam. Anyhow, we'll learn about once you finish the classes you will it gets fixed in your brain that heart failure is equal to breathing difficulty, swelling. MI is equal to chest pain. Okay, there are some classical things, classical symptoms, classical diagnosis for each and everything. That is what NCLEX will be testing you. Of course, you will encounter a lot of difficult questions in your exam, but trust me, if you just think properly, if you use the skills properly, you can get it. Okay, so what I was trying to teach you today is how to summarize the question, how to cook the question, how to what is it, squeeze the question, bring out the essence, keywords, then go with option one, discuss in your brain about option one, write it down, go to option two, three, four, eliminate as much as possible, and then whatever remaining, connect it to the keyword in the question. Okay, so see you guys tomorrow. And again, I apologize for the problems with the Microsoft Teams. I don't know. I think I did something because I'm not a tech guy. But we have Felix here. He's my friend. We both did nursing together back home. He's helping with me with my classes. Okay, so he's trying to figure out what is going on with the teams. It's not a big deal. I don't know what's going on, but anyhow, once we figure out, I'll let you know. And Glaucia, till then, I'm sorry, I'm not able to give you the first class. And first class was just about how the what is that the this thing works, the graph works when you answer the questions in the exam. Okay, so and
Brother Josh, I have a question, please.
Emmanuel.
Could you, that number two answer, I don't know if you could just for 1 minute explain it again. I wasn't clear on how we arrived.
Okay, breathing difficulty. People with breathing difficulty, they automatically go into a position which is known as orthopnea. Okay, where they always try to sit upright,
Yeah,
or they go forward or lean on the table. Okay, so in long-term cares in North America, we can see in the long-term cares home at the night time, many elderly people, they will be sitting on the chair and sleeping. Okay, the reason is because when they lie down, they won't be able to breathe properly. Okay. When they sometimes some people sit on the recliner, some people lean on the over bed table. Okay, so to sleep. So the reason is actually they might have COPD, they might have some kind of breathing difficulty. That is the main reason. Okay, so now you're asking where do you sleep at night? Is to know if he is having any breathing difficulty. Of course, you can ask like, why don't you ask directly? Do you have any breathing difficulty? But again, you have to ask NCSPN. Why are you asking questions like this? This is a very difficult question to answer. Because most of us even will not even like those who are knows that breathing difficulty is the classical sign of heart failure. Even they won't even think like that. Sleeping at night. Maybe people who work in a long-term care home who have seen people having breathing difficulty sitting and sleeping, and they can answer this question, but not everybody. And Emmanuel, our intention is not to answer all question correctly. Our intention is just to pass the exam. Okay, because the exam is not about 100 out of 90 about 100, or it is not about A grade, C grade, not about grades or anything. It is just about how the graph works. So even if you make a mistake in these kind of question, it's not a big deal. Your score is not going to be affected. Anyhow, the rationale for option two is this thing, people who are having breathing difficulty, they do not sleep on the bed. They probably sit upright and sleep. Okay, so that is what the option two is meaning.
okay, I understand it now. Thank you. I see that the answer is in the question itself.
Yeah, the answer is there in the question itself.
Yes, sir. Thank you.
Father,
Yes.
can I ask you one doubt?
Yes, sure, Jenny.
This option 3, fullness of stomach can be lead to breathing difficulties, isn't it?
Yeah, but the question is not about breathing difficulty. Question is about heart failure.
Okay.
We are answering heart failure, not breathing difficulty, right? You get me?
Yeah.
So see,
So,
we are looking into which among this question will help you understand the patient is having a signs and symptoms of heart failure. Okay, so we are looking into an option or an investigation or what assessment which helps you to understand whether the patient is having a heart failure. So in other words, you're looking for an option which says the patient is having a heart failure. Or in other words, we can say you're looking for the signs and symptoms of heart failure.
yeah.
Fullness of stomach is not a sign and symptom of heart failure, right?
Mm.
Fullness of stomach can cause breathing difficulty,
Yeah. But,
but that is not the question. Okay,
mhm.
always try to answer the question. That is another trouble many people have. Instead of trying to answer the question, we try to answer some other ideas. So we should, people riding on a horse, especially the horse race. The horse will have a binder or something on the ice to make sure that the horse do not miss the track. So always, whenever you're reading a question, have that binder and only focus on answering the question, not anything else. Okay, only the summary of the question. Try to answer only the summary of the question. Okay, so if you start thinking, then you might probably answer wrong. Okay, so that is why we should have that narrow concept on answering the question. Okay, not about, we should have a broad idea about your concepts, but a narrow focus on answering the question. Okay, so you have to exclusively focus only on answering the question, not on the background of the question, not anything else. Okay, that is why I say when you bring out a proper good summary, then it is very easy for you to answer. Okay, so see you guys tomorrow. Thank you, everyone. Good night.
Thank you, Father.
Thank you.
Thank you, sir.
Thank you.
Hello. Hi, Jigar. சரி ஓகே நான் இதை ரெடி பண்ணுறேன் அதான் ரெடி பண்ண ரெக்கார்டிங் ரெடி ஆகிட்டு இருக்கு ரெடி பண்ணி எப்படி பண்ணுறேன் போஸ்ட் பண்ணுறேன்